Thank you, Mrs. Stratton. Okay, now we'll move on to other business. And we have the 2021-22 Health and Safety Plan. So, Dr. Teacher?
Recommend approval of the revised 2021-22 Health and Safety Plan as per the attached.
Can I have a motion, please? Motion by Mrs. Wesley. Seconded by Mr. Fusco. Are there any comments or questions?
Well, I don't know, is the community like to see the plan in front of them? They came out to talk about the masking over here. I think we should probably agree with this. Yeah, so just to be clear, since I'm on the regards to the mask, which is the clear, issue of tonight, the plan is to mandate for the elementary schools and to continue to pay the option to mask to community transmission rates for secondary. The table in the plan is on page 8 in the Board docs.
Correct. So it's required for elementary school at all levels of transmission: low, moderate, substantial, and high. Indoors. Outdoors is optional. For secondary, it is recommended for low and moderate indoors, and required for substantial and high. And again, outdoors would be optional.
Okay, just to make sure that I'm correct. Outdoors is optional.
Excuse me.
Except for is that correct? Outdoors is optional except for the high.
So you're outdoors. Is there any other comments or questions?
I want to clarify too that masks are mandated for all students on public buses or school buses, and that is a mandate. Dr. Diedrich, correct me, this is a federal mandate, the one where we do not have to choice.
That's correct.
I'm just going to actually reiterate that question. Do we know what the community transmission looks like as of today?
As of Wednesday of this week, North Penn school districts, municipalities, as you look at those data and aggregate them and apportion them, we are at 61 cases per 100,000. And that would put us into the substantial category. The health and safety plan does call for the category to change after 2 weeks in the same category, then it would officially change. So you'll notice that we're presently in substantial, and if we're in substantial again next week, we would move over to that column then. The secondary masks would be required.
So are there any other questions or comments?
I just have one quick question, just for people who may be watching. I know there's been some questions about lunches. Could you just talk about how you're going to mitigate during lunches? And Dr. Bowell or Dr. Diedrich can just talk generally what the plan is for elementary and middle and high school lunches and how you're going to mitigate them.
Currently, the plan reads, hold on 1 second, Dr. G. On gentlemen in the booth, if you could go to page so page 5, item B, it currently reads that school cafeterias will return to normal operation, but seating chairs will still be maintained for contact tracing purposes. When masking is required, students will wear masks in the cafeteria and will continue doing so unless actively eating with you. That's what the plan currently states.
And
Dr. Diedrich, could you just clarify, because this is what we discussed last week, we had a brief description of the administration exploring, especially at the elementary levels, but possibly the secondary, should there be masking, the opportunity for teachers to instruct without masks. Is that moving forward?
Yes, so I will state again that if the teacher is fully vaccinated and the teacher's professional opinion, and if they are 6 feet or more away from children doing a lesson, that they would have that latitude to be able to drop their mask during that some lessons in the anemic area where if the teacher is fully vaccinated, is in the front of the class, away from the students, to be able to effectively deliver that lesson, we would permit that to happen during that time period.
Thank you. As a follow-up, could you just give a brief description of mask breaks, or is it 7 hours straight of mask?
No, so we still encourage mask breaks. We also do permit doctor's notes for any students who the doctor, in their estimation, would say that the student should not be masked. Those will also be accepted. And we'll also note that in the health and safety plan, it does call for North Penn to engage in a assurance testing program, and that would be required. However, if there is a staff member who is fully vaccinated and can provide proof of vaccination, they would not be required to participate in that. Last year's program was well received by our staff, so I'm pleased that we're able to offer that again to our staff members.
Thank you.
Dr. Dietrich, could you explain how the school district will help students that forget to bring their masks to school?
So we have a supply of masks in the school. If the student does forget to bring their mask, and they'll be provided with a mask by school personnel.
Thank you. Are there any other comments or questions?
One final question. And Dr. Bauer, this is, I'll ask you because you've got a lot of experience with the events and the planning. So should this move forward, is this matrix applicable to any outdoor events we're going to have, such as that which is already planned in this changing variant environment?
Yes, Mr. Hassa, the plan currently reads that the masking guidance as outlined in Appendix A would apply to all events and visitors to the campus. So if it's an outdoor event and masks are optional outdoors, given the level of transmission in the community, then that's what would be the expectation of the visitors to the campus. Same thing with indoors.
Thank you.
Thank you, Dr. Bauer. Are there any other questions?
So, all right, sorry, when will this go into effect?
So with the board's approval, it would go into effect immediately. We would communicate tomorrow that the board has taken action this evening. As I did mention, the communication would indicate that we are presently in the substantial range, and that the health and safety plan does call for 2 weeks within that same range for a change in status. So we're concerned that it appears right now with the modeling that we're looking at that we will stay in substantial for at least a while, which would mean that by the start of school we would be in substantial for 2 weeks, and students would be expected or would be required to be masked.
Dr. Dietrich, if we drop out of substantial to the lower level, how quickly do the mask mandate change?
Okay, so again, at the secondary level, when we drop down to moderate, it does require 2 weeks to be at that level, then we would officially be in the moderate status, and then we would then notify the affected individuals the next day that we are now officially in moderate. So my advice would be to continue to monitor, be on notice at week 1 that it's headed in a particular direction. If you do need 2 weeks at that same status, to change the status.
In either direction.
In either direction, that's correct.
Thank you, Dr. Dietrich. Dr. Dietrich? I'm sorry, President Stover, can I ask a question? Yep, go ahead. So the plan is detailed, but is there a way to pull out table 1, which is the matrix that identifies when levels change so that community, students, teachers are aware of that rather than having to read through 9 pages?
Yes, we can.
Thank you. Are there any other comments or questions?
Dr. Dietrich, just because others might not know this, it's my understanding this chart or the concept of it is somewhat aligned with what was released on July 26th. Can you just describe where you didn't just come up with the chart? I mean, there is guidance.
Yes.
Can you talk about that a little bit?
Yes, that is accurate. The Montgomery County Office of Public Health would establish the transmission level metrics defining low as being 0 to 9 cases per 100,000, and a positivity of less than 5%, and then the moderate at 10 to 49 per 100,000, or a positivity of 5 to 7.9%, substantial being 50 to 99 cases per 100,000, or 8 to 1.9% positivity, and then high at greater than 100 cases per 100,000, or greater than 10% positivity. So those metric levels were defined by the Montgomery County Office of Public Health.
Thank you. Any further comments or questions? Seeing none, I have a motion on the floor. And we have a second. So all in favor say aye.
Aye.
Any opposed?